Section 37 of Gray's Anatomy, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by M.L. Cohen. Anatomy of the Human Body, Part 4 by Henry Gray. Anterior divisions of the spinal nerves, Part 2. The dorsal scapular nerve, nervus dorsalis scapulae, nerve to the rhomboideae, posterior scapular nerve. Arises from the fifth cervical, pierces the scalenus medius, passes beneath the levator scapulae, to which it occasionally gives a twig, and ends in the rhomboideae. The suprascapular, nervus suprascapularis, arises from the trunk formed by the union of the fifth and sixth cervical nerves. It runs lateralward beneath the trapezius and omohyoideus, and enters the supraspinatus fossa through the suprascapular notch, below the superior transverse scapular ligament. It then passes beneath the supraspinatus and curves around the lateral border of the spine of the scapula to the infraspinatus fossa. In the supraspinatus fossa, it gives off two branches to the supraspinatus muscle and an articular filament to the shoulder joint, and in infraspinatus fossa, it gives off two branches to the infraspinatus muscle, besides some filaments to the shoulder joint and scapula. The nerve to the subclavius, nervus subclavius, is a small filament which arises from the point of junction of the fifth and sixth cervical nerves. It descends to the muscle in front of the third part of the subclavian artery and the lower trunk of the plexus, and is usually connected by a filament with the phrenic nerve. The long thoracic nerve, nervus thoracalis longus, external respiratory nerve of Bell, posterior thoracic nerve, supplies the serratus anterior. It usually arises by three roots from the fifth, sixth, and seventh cervical nerves, but the root from the seventh nerve may be absent. The roots from the fifth and sixth nerves pierce the scalenus medius, while that from the seventh passes in front of the muscle. The nerve descends beneath the brachial plexus and the axillary vessels, resting on the outer surface of the serratus anterior. It extends along the side of the thorax to the lower border of that muscle, supplying filaments to each of its digitations. The branches for the longus colli and scaleni arise from the lower four cervical nerves at their exit from the intervertebral foramina. Infraclavicular branches. The infraclavicular branches are derived from the three cords of the brachial plexus, but the fasciculi of the nerves may be traced through the plexus to the spinal nerves from which they originate. They are as follows: musculocutaneous, fifth, sixth, and seventh cervical; lateral cord; lateral anterior thoracic, fifth, sixth, and seventh; lateral head of the median, sixth and seventh; medial anterior thoracic; medial antebrachial cutaneous, sixth and seventh; medial cord; medial brachial cutaneous; eighth cervical, first thoracic; ulnar; medial head of median, also eighth cervical, first thoracic; upper subscapular, fifth and sixth cervical; lower subscapular, fifth and sixth cervical; posterior cord; thoracodorsal, fifth, sixth, and seventh cervical; axillary, fifth and sixth cervical; radial, sixth, seventh, eighth cervical, first thoracic. The anterior thoracic nerves, nervus thoracalis anterioris, supply the pectoralis major and minor. The lateral anterior thoracic, fasciculus lateralis, the larger of the two, arises from the lateral cord of the brachial plexus, and through it from the fifth, sixth, and seventh cervical nerves. It passes around the axillary artery and vein, pierces the coracoclavicular fascia, and is distributed to the deep surface of the pectoralis major. It sends a filament to join the medial anterior thoracic and form with it a loop in front of the first part of the axillary artery. The medial anterior thoracic, fasciculus medialis, arises from the medial cord of the plexus and through it from the eighth cervical and first thoracic. It passes behind the first part of the axillary artery, curves forward between the axillary artery and vein, and unites in front of the artery with a filament from the lateral nerve. It then enters the deep surface of the pectoralis minor, where it divides into a number of branches which supply the muscle. Two or three branches pierce the muscle and end in the pectoralis major. The subscapular nerves, nervus subscapularis, two in number, spring from the posterior cord of the plexus and through it from the fifth and sixth cervical nerves. The upper subscapular, short subscapular, the smaller, enters the upper part of the subscapularis and is frequently represented by two branches. The lower subscapular supplies the lower part of the subscapularis and ends in the teres major. The latter muscle is sometimes supplied by a separate branch. The thoracodorsal nerve, nervus thoracolodorsalis, middle or long subscapular nerve. A branch of the posterior cord of the plexus derives its fibers from the 5th, 6th, and 7th cervical nerves. It follows the course of the subscapular artery along the posterior wall of the axilla to the latissimus dorsi, in which it may be traced as far as the lower border of that muscle. The axillary nerve, nervus axillaris, circumflex nerve, arises from the posterior cord of the brachial plexus, and its fibers are derived from the 5th and 6th cervical nerves. It lies at first behind the axillary artery and in front of the subscapularis, and passes downward to the lower border of that muscle. It then winds backwards in company with the posterior humeral circumflex artery through a quadrilateral space bounded above by the subscapularis, below by the teres major, medially by the long head of the triceps brachii, and laterally by the surgical neck of the humerus, and divides into an anterior and a posterior branch. The anterior branch, upper branch, lies around the cervical neck of the humerus beneath the deltoideus, with the posterior humeral circumflex vessels as far as the anterior border of that muscle, supplying it and giving off a few small cutaneous branches which pierce the muscle and ramify in the skin covering its lower part. The posterior branch, lower branch, supplies the teres minor and the posterior part of the deltoideus. Upon the branch to the teres minor, an oval enlargement, pseudoganglion, usually exists. The posterior branch then pierces the deep fascia and is continued as the lateral brachial cutaneous nerve, which sweeps around the posterior border of the deltoideus and supplies the skin over the lower 2/3 of the posterior part of this muscle, as well as that covering the long head of the triceps brachii. The trunk of the axillary nerve gives off an articular filament which enters the shoulder joint below the subscapularis. The musculocutaneous nerve, nervus musculocutaneus, arises from the lateral cord of the brachial plexus opposite the lower border of the pectoralis minor, its fibers being derived from the 5th, 6th, and 7th cervical nerves. It pierces the coracobrachialis muscle and passes obliquely between the biceps brachii and the brachialis to the lateral side of the arm. A little above the elbow, it pierces the deep fascia lateral to the tendon of the biceps brachii and is continued into the forearm as the lateral antebrachial cutaneous nerve. In its course through the arm, it supplies the coracobrachialis, biceps brachii, and the greater part of the brachialis. The branch to the coracobrachialis is given off from the nerve close to its origin, and in some instances as a separate filament from the lateral cord of the plexus. It is derived from the 7th cervical nerve. The branches to the biceps brachii and brachialis are given off after the musculocutaneous has pierced the coracobrachialis. That supplying the brachialis gives a filament to the elbow joint. The nerve also sends a small branch to the bone, which enters the nutrient foramen with the accompanying artery. The lateral antebrachial cutaneous nerve, nervus cutaneus antebrachii, cutaneus lateralis, branch of the musculocutaneous nerve, passes behind the cephalic vein and divides opposite the elbow joint into a volar and a dorsal branch. The volar branch, ramus volaris, anterior branch, descends along the radial border of the forearm to the wrist and supplies the skin over the lateral half of its volar surface. At the wrist joint, it is placed in front of the radial artery and some filaments piercing the deep fascia accompanying that vessel to the dorsal surface of the carpus. The nerve then passes downward to the ball of the thumb, where it ends in cutaneous filaments. It communicates with the superficial branch of the radial nerve and with the palmar cutaneous branch of the median nerve. The dorsal branch, ramus dorsalis, posterior branch, descends along the dorsal surface of the radial side of the forearm to the wrist. It supplies the skin of the lower 2/3 of the dorsolateral surface of the forearm, communicating with the superficial branch of the radial nerve and the dorsal antebrachial cutaneous branch of the radial. The musculocutaneous nerve presents frequent irregularities. It may adhere for some distance to the median and then pass outward beneath the biceps brachii instead of through the coracobrachialis. Some of the fibers of the median may run for some distance in the musculocutaneous and then leave it to join their proper trunk. Less frequently, the reverse is the case, and the median sends a branch to join the musculocutaneous. The nerve may pass under the coracobrachialis or through the biceps brachii. Occasionally, it gives a filament to the pronator teres, and it supplies the dorsal surface of the thumb when the superficial branch of the radial nerve is absent. The medial antebrachial cutaneous nerve, nervus cutaneus antebrachial medialis, internal cutaneous nerve, arises from the medial cord of the brachial plexus. It derives its fibers from the 8th cervical and 1st thoracic nerves and, at its commencement, is placed medial to the axillary artery. It gives off near the axilla a filament which pierces the fascia and supplies the integument covering the biceps brachii nearly as far as the elbow. The nerve then runs down the ulnar side of the arm medial to the brachial artery, pierces the deep fascia with the basilic vein about the medial of the arm, and divides into a volar and an ulnar branch. The volar branch, ramus volaris anterior branch, the larger, passes usually in front of but occasionally behind the vena mediana cubiti, median basilic vein. It then descends on the front of the ulnar side of the forearm, distributing filaments to the skin as far as the wrist, and communicating with the palmar cutaneous branch of the ulnar nerve. The ulnar branch, ramus ulnaris posterior branch, passes obliquely downward on the medial side of the basilic vein, in front of the medial epicondyle of the humerus, to the back of the forearm, and then descends on its ulnar side as far as the wrist, distributing filaments to the skin. It communicates with the medial brachiocutaneous, the dorsal antibrachial cutaneous branch of the radial, and the dorsal branch of the ulnar. The medial brachiocutaneous nerve, nervus cutaneous brachii medialis, lesser internal cutaneous nerve, nerve of Risberg, is distributed to the skin on the ulnar side of the arm. It is the smallest branch of the brachial plexus, and arising from the medial cord receives its fibers from the 8th cervical and 1st thoracic nerves. It passes through the axilla, at first lying behind and then medial to the axillary vein, and communicates with the intercostobrachial nerve. It descends along the medial side of the brachial artery to the middle of the arm, where it pierces the deep fascia and is distributed to the skin of the back of the lower third of the arm, extending as far as the elbow, where some filaments are lost in the skin in front of the medial epicondyle and others over the olecranon. It communicates with the ulnar branch of the medial antibrachial cutaneous nerve. In some cases, the medial brachiocutaneous and intercostobrachial are connected by 2 or 3 filaments, which form a plexus in the axilla. In other cases, the intercostobrachial is of large size and takes the place of the medial brachiocutaneous, receiving merely a filament of communication from the brachial plexus, which represents the latter nerve. In a few cases, this filament is lacking. End of section 37.